Careers and Jobs in the USA number 11. Physician Assistants. Learn about careers and jobs in the United States of America and improve your American English with Maestro Sersea. What physician assistants do? Part 1. Physician assistants, also known as PAs, practice medicine on teams with physicians, surgeons, and other healthcare workers. They examine, diagnose, and treat patients. Physician assistants work on teams with physicians or surgeons and other healthcare workers. Their specific duties and the extent to which they must be supervised by physicians or surgeons differ from state to state. Physician assistants work in all areas of medicine, including primary care and family medicine, emergency medicine, surgery, and psychiatry. The work of physician assistants depends in large part on their specialty or the type of medical practice where they work. For example, a physician assistant working in surgery may close incisions and provide care before, during, and after the operation. A physician assistant working in pediatrics may examine a child and give routine vaccinations. In some areas, especially rural and medically underserved communities, physician assistants may be the primary care providers at clinics where a physician is present only 1 or 2 days per week. In these locations, physician assistants collaborate with the physician as needed and as required by law. Some physician assistants make house calls or visit nursing homes to treat patients. Physician assistants are different from medical assistants. Medical assistants do routine clinical and clerical tasks and do not practice medicine. What physician assistants do? Part 2. Duties. Physician assistants typically do the following: take or review patients' medical histories, examine patients, order and interpret diagnostic tests, such as X-rays or blood tests, diagnose a patient's injury or illness, give treatment such as setting broken bones and immunizing patients, educate and counsel patients and their families, for example, answering questions about how to care for a child with asthma, prescribe medicine, assess and record a patient's progress, research the latest treatments to ensure the quality of patient care, conduct or participate in outreach programs, talking to groups about managing diseases and promoting wellness. Physician assistants, work environment, and work schedules. Physician assistants held about 125,500 jobs in 2019. The largest employers of physician assistants were as follows: offices of physicians, 54%. Hospitals, state, local, and private, 26%. Outpatient care centers, 8%. Educational services, state, local, and private, 4%. Employment services, 1%. Working with patients can be both physically and emotionally demanding. Physician assistants spend much of their time on their feet, making rounds and evaluating patients. Physician assistants who work in operating rooms often stand for extended periods. Work schedules. Most physician assistants work full-time. Some work more than 40 hours per week. Physician assistants may work nights, weekends, or holidays. They may also be on call, meaning that they must be ready to respond to a work request with little notice. Physician assistants, how to become one, Part 1. Physician assistants typically need a master's degree from an accredited educational program. Earning that degree usually takes at least 2 years of full-time postgraduate study. All states require physician assistants to be licensed. Physician assistant graduate school applicants typically have experience caring directly for patients. Education. Most applicants to physician assistant education programs already have a bachelor's degree and some patient care work experience. Although admissions requirements vary from program to program, most programs require 2 to 4 years of undergraduate coursework with a focus in science. Most applicants already have experience as registered nurses or as EMTs or paramedics before they apply to a physician assistant program. Physician assistant education programs usually take at least 2 years of full-time study. More than 200 education programs were accredited by the Accreditation Review Commission on Education for the Physician Assistant, Incorporated, ARC.PA, in 2017. Although all of these accredited programs offer a master's degree, almost all of these accredited programs offer a master's degree. Physician assistant education includes classroom and laboratory instruction in subjects such as pathology, human anatomy, physiology, clinical medicine, pharmacology, physical diagnosis, and medical ethics. The programs also include supervised clinical training in several areas, including family medicine, internal medicine, emergency medicine, and pediatrics. Sometimes students serve in one or more clinical rotations in these areas under the supervision of a physician who is looking to hire a physician assistant. In this way, clinical rotations may lead to permanent employment. Work experience in a related occupation. Applicants to physician assistant graduate programs typically need patient care experience for admission or to be competitive in entering the programs. Work as an EMT or paramedic, registered nurse, nursing assistant, or similar care position typically fulfills patient care experience requirements for admission to academic programs. Some applicants gain healthcare experience through volunteer opportunities at hospitals or clinics, or working with special needs or at-risk groups, such as orphaned youth or homeless populations. For specific requirements, contact the program in which you are interested. Physician assistants, how to become one. Part 2, important qualities. Communication skills. Physician assistants must explain complex medical issues in a way that patients can understand. They must also effectively communicate with doctors and other healthcare workers to ensure that they provide the best possible patient care. Compassion. Physician assistants deal with patients who are sick or injured and may be in extreme pain or distress. They must treat patients and their families with compassion and understanding. Detail-oriented. Physician assistants should be observant and have a strong ability to focus when evaluating and treating patients. Emotional stability. Physician assistants, particularly those working in surgery or emergency medicine, should work well under pressure. They must remain calm in stressful situations in order to provide quality care. Problem-solving skills. Physician assistants need to evaluate patients' symptoms and administer the appropriate treatments. They must be diligent when investigating complicated medical issues so they can determine the best course of treatment for each patient. Physician assistants, licenses, certifications, and registrations. All states and the District of Columbia require physician assistants to be licensed. To become licensed, candidates must pass the Physician Assistant National Certifying Examination, PANCE, from the National Commission on Certification of Physician Assistants, NCCPA. A physician assistant who passes the exam may use the credential Physician Assistant Certified, PAC. To keep their certification, physician assistants must complete 100 hours of continuing education every 2 years. The recertification exam is required every 10 years. In addition, state licensure laws require physician assistants to hold an agreement with a supervising physician. Although the physician does not need to be on site at all times, collaboration between physicians and physician assistants is required for practice. Physician assistants pay. The median annual wage for physician assistants was $115,390 in May 2020. The median wage is the wage at which half of the workers in an occupation earned more than that amount and half earned less. The lowest 10% earned less than $76,700, and the highest 10% earned more than $162,470. In May 2020, the median annual wages for physician assistants in the top industries in which they worked were as follows: outpatient care centers, $124,610. Hospitals, state, local, and private, $118,600. Employment services, $115,780. Offices of physicians, $113,460. Educational services, state, local, and private, $110,770. Most physician assistants work full-time. Some work more than 40 hours per week. Physician assistants may work nights, weekends, or holidays. They may also be on call, meaning that they must be ready to respond to a work request with little notice. Physician assistants, job outlook. Employment of physician assistants is projected to grow 31% from 2019 to 2029, much faster than the average for all occupations. Demand for healthcare services will increase because of the growing and aging population. Growth of the population means more need for healthcare services generally, and members of the large baby boom generation will require more medical care as they age. An increase in the number of patients with chronic diseases such as diabetes will also increase healthcare demand and, in turn, drive the need for healthcare providers, including physician assistants, who often provide preventive care and treat the sick. Furthermore, increases in incomes may improve access to healthcare services, and advances in medical technology will continue to increase the number and types of treatments available. Physician assistants can provide many of the same services as physicians. PAs are expected to continue to have a growing role in providing healthcare services because they can be trained more quickly than physicians. Team-based healthcare provision models will continue to evolve and become more commonly used. Physician assistants will have growing roles in all areas of medicine as states expand allowable procedures and autonomy, and as insurance companies expand their coverage of physician assistant services. Job prospects. Good job prospects are expected in primary care and across all specialties, particularly for physician assistants working in rural and medically underserved areas. Physician assistants summary. 2020 median pay $115,390 per year, $55.48 per hour. Typical entry-level education, master's degree. Number of jobs 2019, 125,500. Job outlook 2019-2029, 31%, much faster than average. Employment change 2019-2029, 39,300. Citation: Bureau of Labor Statistics, U.S. Department of Labor, Occupational Outlook Handbook, Physician Assistants, at www.bls.gov, healthcarephysicianassistants.htm. Visited May 12, 2021.